cognizant that the inside here is a little sensitive. So as we're working down, we're using our windshield wiper, going all directions, making sure in this last 3 inches we hit the quadricep tendon really well, cleaning this up. This is where a lot of the issues are.
Yeah, you have 2 tendons in that knee that are super important, and that's going to be the quadricep tendon above and the patella tendon right below, where it connects down to the tibia and fibula area. So that's going to be me feeling like I can stand and I am like well adapted and balanced. And then the quadricep tendon helps extend the leg inflection and extension. So if people have like a lot of limitation there, yes, it can be around the hinge where the ACL, MCL, and PCL are. But the quadricep tendon has definitely gotten a little calcified because that's where the quad is so activated.
So once we get down, cleaning up the whole area, we're going to come into cleaning up around the patella, which is right here.
And stay on the ledge. People go way too far. Mm-hmm. They try to get down on the sides. We do the sides.
So we're going to stay right in this groove, all the way around. We're going to be cleaning in that joint. Remember what I told you with the hips around the greater trochanter, you're going to clean around these joints to get in there because this inside is where the problem is. As we're working,
you personally could never work on the ACL, MCL, and PCL because they're inside of the knee. So we have to work out what's kind of leaching off inwards, and that's the scar tissue surrounding now the joint.
And I also, once I do a knee treatment, I emphasize to my clients how important that clapping is afterward because I've loosened everything up and they can get so much from the clapping. I've had like a ball form, 2 balls of fluid after I've had a treatment just by clapping up here, and the ball came out over here and down here. As soon as that, I had like a clicking or a snapping, and as soon as that, I stopped clapping, it went away. I had a little tiny bit of bruising, and guess what? No clapping, no clicking, no anything, no weird feelings. So clapping is so important with the joints, so important. So as we work around around the patella, we're going to also use our guide hand to hold on to the patella. We're going to clean the top, just a mild cleaning. We're not going to find too much.
Yeah, and you normally ask your client, have you ever had any injuries? Oh, I shattered my patella. I know then you're going to spend a lot of time on top of it. Majority of people that have knee issues and it's restriction or my knee's tight or it aches, I don't really spend much time on top of the patella. It's about what's inserting around the knee, around vastus medialis and lateralis.
And then we're going to finish off pulling down into the patella tendon, cleaning all around. And the time, we have four positions, so 15 minutes.
Yeah, so it's 7 minutes one direction, 7 minutes the other. Interject with little bits of effleurage massage.
So once we finish face to face, and we'll pull back up, obviously, then you're going to work the 7 minutes. So however many times that you can pull down and up, it's not just one rotation.
And there's no right or wrong when it comes down, did you go to the lateral side? If they had surgery and there's a large incision, just say on her lateral side, I'm going to start on the medial. Get her accustomed. Vice versa if it was on the medial and lateral. But if there's no incision and they just have knee issues, you can go around the patella from the medial to the lateral to the medial. There's no right or wrong. You're just circulating that area.
So now we're moving to face to feet, and we're doing the exact same thing. Starting 6 inches up, using the windshield, opening up the quadriceps, opening up